To experience general angst and stress is completely normal, especially throughout our averagely turbulent adolescent years. We may run into difficult times and experiences that will bring out some deep emotional feelings within ourselves, which we can categorise this as natural anxiety. However, a serious problem arises when these feelings don't subside. They intensify and they begin to interfere with our ability to function productively in daily life. If you endure this extreme stress and unpleasant emotion for more than 2 consecutive weeks, we can define that as generalised anxiety disorder. Anxiety is a rather broad and complex subject, especially as it has 6 sub-illnesses. The aforementioned generalised anxiety disorder, phobias, panic disorder, obsessive compulsive disorder, acute stress disorder, and post-traumatic stress disorder. In the study of psychology, there are 4 levels of explanation regarding to behaviour. I will cover each of them for a greater understanding of anxiety. These are the biological level, the person level, the socio-cultural level, and the basic processes level. But let's start from the top with the biological level of explanation. This explains behaviour as the result of factors such as neurology, hormones, hereditary, and brain chemistry. To explain anxiety from a biological point of view, we need to begin from the endocrine system. The endocrine system consists of glands that discharge chemicals known as hormones, and these hormones pass directly into the bloodstream and act as little chemical messengers. There are 2 basic types of chemical messengers, hormones and neurotransmitters, which both send messages all throughout our bodies. Neurotransmitters are what we need to try and understand next. So, there are 2 specific types of neurotransmitters, inhibitory and excitatory. The excitatory neurotransmitters aren't actually very exciting. Basically, they stimulate the brain. It's the inhibitory neurotransmitters that we're interested in. They essentially calm our brains and assist with balancing our moods. Now, let us meet serotonin. This is a type of inhibitory neurotransmitter, which is the most common of neurotransmitters to be associated with anxiety. Those who experience anxiety have decreased levels of serotonin, and these decreased serotonin levels can also be associated with mood, appetite, and sleeping issues. Next, apart from serotonin, we need to know GABA, or gamma-aminobutyric acid, another inhibitory neurotransmitter that has also been linked to anxiety. This GABA essentially slows down the neurotransmission to calm the brain and in turn relax the body. Those who experience chronic anxiety are reasonably likely to have GABA deficiency, which further proposes the idea that those with a GABA deficiency have a biological vulnerability to a greater level of stress and anxiety due to the fact that their body is already experiencing a higher state of arousal and vigilance. A symptom that occurs due to the biological factors is the fight or flight response, which is simulated by a circumstance that is either mentally or physically threatening. It is our body's primitive and inborn response that prepares us to fight or fly or escape from an attack or harmful threat to our survival. So, what can be done to help treat anxiety from a biological factor? Something that is extremely daunting yet proven to be an effective treatment is medication, and specifically selective serotonin reuptake inhibitors, or SSRIs. So how does this actually work? Basically, the purpose of an SSRI is to stop the reabsorption of the serotonin by the nerve cells, meaning that there's more serotonin ready and available to pass messages that beneficially influence our moods, emotions, and sleeping abilities. Like any medication, there come side effects that very, very few people actually experience, but if experienced, are generally passed within the first month or so. Now, let's talk about the person level of explanation, which explains behaviours as a result of circumstances such as age, personality traits and characteristics. Age is a very large contributing factor to anxiety, as within Australia it appears that anxiety disorders are rather prevalent in people of my age group, so the young adult age group. For those of us experiencing irritability, negativity, excessive guilt and uncontrollable mood swings, it's not to worry. These are all symptoms of anxiety that correlate with the person level of explanation, which leads us to talk about a treatment to tie in with these factors. Acceptance and commitment therapy can assist in the acceptance of overcoming the difficulties within our lives. It can help us take a positive step forward and deal with the persistently difficult emotions alongside with similar personality traits. Now it's time to address the socio-cultural level, which explains anxiety as a result of influences had on us by our environment, culture, the world and society which we live in, and our relationships with family and friends. Specific symptoms associated with socio-cultural influences can include antisocial behaviour and avoidance of friends, family and social situations. To treat this behaviour, a strategy commonly used is the interpersonal therapy. This essentially focuses on social roles and interpersonal reactions. 4 problematic areas in which interpersonal therapy focuses on are unresolved grief, role disputes, role transitions, and interpersonal deficits. This is done alongside a therapist in aim to build and improve relationships. The final level of explanation is the basic processes level, which refers to the traits that are common within each and every one of us, yet variable depending on perception, memory, and learning traits individual to us. Anxiety-related symptoms can include elongated grievance periods, reduced motivation, and an inability to learn, concentrate, and retain information. A treatment that is cohesive with the basic processes level is cognitive behavioural therapy, or CBT. This therapy type recognises the ways in which we think, which are our cognitions, and the ways in which we act, which are our behaviours, and how these all affect our feelings. CBT sees us working alongside a professional to assess the thoughts that restrain the improvement of our anxiety. A range of techniques can be explored, including the encouragement to acknowledge differences between productive and unproductive worries, and very importantly, the ability to let go of stressful burdens and worries. In sum, anxiety is overwhelming, yet treatable. If this has been triggering to you or has been extremely relatable to your actions, behaviours and lifestyle, and you want to know more, visiting the Beyond Blue or Headspace websites online is recommended, as well as seeking advice from your local GP. Thank you.